joins us. Yay, it's always good to have you here. We were going to talk a little bit about pregnancy. So we talked about the first trimester last time you were here, which has its own set of challenges, but we are going to talk now about the second and the third trimester. So I don't know about you, but the second trimester was fantastic for me in both my pregnancies. Well, that's what it's supposed to be. So it's supposed to be the honeymoon of pregnancy. Yes. The honeymoon, which is typically a happy time. The first trimester, you know, we talked about being nauseated and tired and all the rest of it. Your second trimester, it's like you wake up. There are reasons for that. It makes sense physiologically as well. You know, the pregnancy hormone, HCG, we talked about in the first trimester how it makes you feel sick and vomitous. Okay? Yes. In the second trimester, that level of hormone tapers off. And then the nausea goes away. Right. And some of the food aversions lift. So it's kind of, you have that magical moment initially. And patients talk about it all the time. Once you've experienced it, you're like, wow, it's true. But it's relevant, it's relative to what's happening to you physiologically. So HCG goes down. The progesterone that also made you feel kind of awful and tired stabilizes. So you don't feel so tired. So you have this kind of rejuvenation. And also now your uterus is starting to grow, but it's growing up, it's not growing out yet. And because the uterus sits on the bladder, as it grows up, it eases off the bladder a little. So then you don't have to go to the bathroom so much. Which is great. Until later. Wait, we're going to get to the third trimester. I know, it comes back. And you get movement too, so what we call quickening, so people are aware of movements of the baby. So it's kind of the fun time. You have an anatomy scan, you can see what the sex of your baby is. This all happens in the second trimester. So what's happening in your body is a little bit easier, but also a lot of people are able to talk to people about their pregnancy, which is nice. Yeah. They are also looking more pregnant rather than just looking like they had 12 burgers. Yeah, well, so people still look kind of chubby. So in your first pregnancy, you look kind of chubby. You're not still quite there. And then as you move into the third trimester, because your uterus, the top of your uterus reaches the belly button at about 20 weeks. Okay. So that's towards the end of the second trimester. Right. So once it starts getting past there, then people know it's not just gas. They feel safe saying, oh, congratulations. And there's something nice about that. Yeah, so it's like, I'm not just chunky, I'm pregnant. So and then you feel cute. And then you feel okay. So not only are you feeling better from a physiologic and daily standpoint, but you are also looking, and you know that whole glow of pregnancy where you say to people, she has that glow? Well, really there's an explanation physiologically. Your blood flow doubles to triples in pregnancy. Yeah. And so it goes to the face, so people look flushed in the face. Some women feel a little more enthusiastic in the bedroom because it goes to the other regions, the blood flow. Interesting. So there's all explanation for all of these things. Okay. So fine. So that's the second trimester. There are some, you know, downsides as you get larger. As the uterus enlarges, it puts pressure on the veins that return blood to your heart. So you can start with the veins and the spider veins, and you get a little bit of varicosities. Your ankles may swell a little, but you put them up and then the swelling goes down. So this is the happy time. Right. You can still get away with the swelling going down in your second trimester. It still goes away. Not so much in your third. Not for me anyways. My feet were like Shrek. Yeah. At the very end I was like, what happened? Cankles. Oh yeah, I had the cankles. You don't have calves and you don't have ankles. They're just one continuous flow. Yes. It was like from my thigh down, a trunk. Exactly, and you put them up high, you have them on chairs, and they just don't go. You wear those pressure stockings? No, I actually didn't get to that point. Oh, I squeezed. I tried. And it didn't really make a difference. But it does help for those women who have trouble with those varicosities, because you know, you do what your sisters and your mothers do. We have certain things that are bad on us that are good on other people. Right. So the stockings, those pressure stockings are a good thing. You get them at the pharmacy, and they can help you get through the day, especially if you're on your feet all day long and you have to work. Right. Those are one of the days of getting through. So in the third trimester, things get really large. So this is where the uterus, again, it has no more room to go up. Yes. So people get short of breath. Right. There is a physiologic point where your lung residual volume diminishes in pregnancy, and that's relative to hormones. So you get short of breath not just because of the mechanical push of the uterus, it also is physiologically because of hormones. So people feel short of breath even worse because the uterus is really large. Yeah. Then it moves forward. So remember I said the bladder was in front? So as the uterus enlarges, it squishes the bladder down. So peeing becomes an Olympic sport. Yes. Right? So you're all the time. All the time. So there's another explanation for why it happens. Not because you're drinking more, it's just because of what's happening. Yeah. And also now, it's hard to sleep not just because of the size of the uterus and because you're short of breath, but it's also because the baby's on its schedule now. So now, the more active you are, it kind of rocks the baby. So it doesn't move so much when you're up and at 'em. When you decide to rest,
and go to bed, when we're like, I don't know what's going on in there, but the level of activity is beyond anything I felt. So initially in the second trimester, you're happy for movement.
Right.
The third trimester, you're like, just take a break already.
Yeah.
So the things you need to worry about, the things you need to watch out for in the third trimester is because now your uterus starts practicing the contraction called Braxton Hicks's. So those are normal. The uterus needs to understand the communications. But if you get strong contractions in your third trimester, in your 30 weeks until delivery, you need to talk to your healthcare provider about them, because that can start to shorten your cervix and you can have preterm labor. And we don't want that to happen.
No.
And then any bleeding in the third trimester is also, remember the first trimester we said it could be okay?
Yeah.
Bleeding in the third trimester
Red
is
flag.
never, go find somebody and tell them about it, go to the hospital, talk to your healthcare provider so that they know to see if sometimes the placenta detaches, or sometimes people rupture their membranes and their cervix bleeds early. So those are things, red flags that heralds a need to have intervention.
Right.
The other things you can deal with, but the red flag things you need to seek help.
See somebody.